Yeah, it's not. And Dr. Bendell, and stay with me if you would, Chris, but
Sure.
Dr. Bendell, let me get your take on the new details that we got from President Carter. Melanoma, you think about it as being superficial on the skin. In this case, it was in the liver, and now 4 different spots on the brain. It's very unusual, isn't it?
It is a very unusual cancer, but we're seeing this happen where people, we don't even know where their skin lesions are, but they've presented with melanoma inside their bodies.
And so what is the treatment? What is the prognosis? And someone who's going to be 91 in 2 months, is it different, I presume, how you treat something like that with someone who's, who has that age?
I think President Carter said it the best, is that so many advances have happened in the treatment of melanoma in the last few years. It used to be when patients had melanoma that had spread outside of the area of the skin, we had some chemotherapies, we had some targeted therapies that didn't work very well, but there's been a huge boom in the possible therapies that we have for this disease. And the one that he's getting, this drug pembrolizumab, is an immune therapy. So all of us at any time in our lives potentially have cancers in our bodies. But what happens is our immune system comes and they kill off those cancer cells. But as cancer takes hold, it develops almost a shield from that immune system, so the immune system can't attack it. And what we've learned to do with these new drugs, these immunotherapies, is to block that shield and let the immune system itself attack the cancer. And we've seen remarkable results with these therapies, and actually a minimum of side effects. So it very well could be that he continues on with an excellent quality of life, even receiving treatment for his cancer.
And he was talking about drugs that help deal with or mitigate the after effects of these medicines, right? And the radiation treatment.
Correct. The other thing that we've made a lot of advances with in cancer in the last few years are all of the supportive medications that are available to help with things like nausea, diarrhea, fatigue, etc. So supportive care has become such an important part of cancer therapy. We've even seen in some studies that giving that supportive care and being good at that supportive care will actually improve patients' survival to the degree that chemotherapy or other treatments do.
Yeah, and Jonathan.